stereochemistry. It is the chemistry of three dimensions, the chemistry of isomer, and it's called the heart of chemistry. Benefits of stereochemistry in pharmacy are: 1. Increase receptor selectivity and potency. 2. Decrease adverse effect. 3. Decrease dose given to patient. 4. Decrease potential drug-drug interaction. 5. Increase safety margin. Chirality. Chirality is a word come from the Greek word chir, means hand. Chiral atom, it is bent to 4 different groups, while achiral atom, it is bent to not 4 different groups. Isomers. Isomers are compounds with the same molecular formula, differ in the physical and or chemical properties. Isomers are divided into 1. Constitutional isomer. Isomer with the same formula, differ in connectivity of atoms. For example, ether and ethanol. 2. Stereoisomer. Isomers have the same formula and connectivity, but differ in the arrangement of their atoms. Stereoisomers are divided into 1. Diisomers. Diisomers are not mirror image of each other, while enantiomer, stereoisomer that are mirror image, not superimposed. When 2 isomers are in the same compound, the compound is called rhythmic mixture. For example, ofloxacin. Ofloxacin. Ofloxacin is a synthetic antibiotic of the fluorocolonal drug class. Mechanism: it is functioned by inhibiting DNA gyrase, thereby inhibiting bacterial cell division. Brand name is Oflox. Structure: ofloxacin is a racemic mixture, is R form, which consists 50% of S isomer, levofloxacin, the biological active component, and the other 50% is mirror image or enantiomer, R isomer, dextrofloxacin. The structure of ofloxacin.
In this video, I'm gonna explain the structure of ofloxacin. Ofloxacin consists of 18 carbon atoms, 20 hydrogen, 3 nitrogen, 4 oxygen, and 1 fluorine. Chirality of ofloxacin. Ofloxacin has only one chiral center, which is this carbon atom, because it binds to 4 different groups, which are this nitrogen atom and this carbon atom, which binds to hydrogen and oxygen, and the methyl group and hydrogen. Isomers of ofloxacin. According to the law, which give us the number of isomers, where n is the number of chiral center, and since ofloxacin has only one chiral center, so it has 2 isomers. These isomers are dextrofloxacin and levofloxacin, and both are mirror image, not superimposed. So levofloxacin, the first isomer, in which the methyl group is at the front and the hydrogen at the back, and we call it S isomer because if we try to order the atom that bind to the carbon chiral according to their atomic number, then we will give this nitrogen number 1 because nitrogen has the highest atomic number, and then we will give the carbon atom which binds to hydrogens and oxygen number 2, and then we will give the methyl group number 3 and the hydrogen number 4. So its anti-clockwise S isomer. The other isomer, which is dextrofloxacin, in which the methyl group at the back and the hydrogen at the front. And we call it R isomer because the nitrogen will take number 1, this carbon number 2, methyl group number 3, the hydrogen in the front number 4. So anti-clockwise, but we make shift between 3 and 4. So from S to R, then R isomer, dextrofloxacin.
Action of isomers on the polarimeter.
In order to understand the effect of isomers on the polarimeter, we have to know some points about the polarimeter. Polarimeter consists of left-hand skull, right-hand skull, knob, allied torus, sample cell in which we put the container that contain the sample in it, and the container. So, how does the polarimeter work? After you put the sample in the polarimeter, turn the polarimeter. You will notice a change in the lightness. If light on sides and dark in the middle, turn knob clockwise. This is a positive scale or dextrorotary, same thing with dextrofloxacin. But on the other case, or the opposite case, if dark on sides and light in the middle, turn knob anti-clockwise and read the left-hand scale. This is a negative scale or levotatory, same thing with levofloxacin. Then turn knob until the field is all the same lightness, and it choose the appropriate scale and read the number through it.
Potency of isomers. This isomer of ofloxacin was 8 to 128 times more potent or active than the other isomer, R isomer, and approximately 2 times more active than the racemate SNR of ofloxacin. This isomer, levofloxacin, has been separated as a drug, and its brand name is Levobact. Dose: since levofloxacin is 2 times active than the racemic mixture of ofloxacin, the dose of levofloxacin tab is 1 tablet daily. While the dose of ofloxacin is 2 tablets daily. Route of administration: orally, intravenous administration, topical use as eye drops and air drops.
Medical uses. It's used for 1. Acute bacterial cytositis. 2. Acute bacterial infection of chronic bronchitis. 3. Complicated skin and skin structure infection. 4. Mixed infection of urethra and cervix. 5. Acute pelvic inflammatory disease. 6. Complicated urinary tract infection and prostatitis. 7. Inhalational anthrax.
Side effects: nausea, diarrhea, constipation, stomach pain or cramps, vomiting, loss of appetite, dry mouth, headache, dizziness, excessive tiredness, pain, swelling or itching of the vagina.